You know, and having that conversation with Linda as we think about the difficulties of coming back home after war on this Vietnam Veterans Appreciation Day. The truth is, it's not soldiers alone who deal with struggles every day. Our first responders do as well. Trauma can take any type of form, and finding a way then to cope and deal with it can sometimes be a very long journey. So we're so happy to have on the show this morning our good friend Charles Miller, who's here with Scenic City Neurotherapy, and with him he has brought Anna McCurdy, who has RailRoad Valley Therapeutics. The two kind of work in tandem, and you'll hear more about that as our conversation goes on. So good to see you both.
Thank you. Good to see you.
Anna, I do want to begin with you because often what happens, I'm gathering, is that people are coming to you. You specialize in PTSD in your practice, and so different types of clients are coming to you, and you say they hit kind of this stopping point where they're not progressing as quickly as you'd like to see, and that's where Charles kind of comes in.
Yeah, so we see a lot of, trauma therapists see a lot of what we call stress adaptations. And so those tend to show up in therapy and block what we call integration of the material. And when that happens, you hit kind of that plateau of progress, and that might be the time that I would recommend someone to do an adjunct therapy, one that is so responsive, like ketamine infusion.
So before we get Charles into the conversation, you were sharing with me that often you're finding, as a practice, not just your own, but with your profession, that people who really struggle with PTSD often have another hiccup, I'll use that word, earlier in their life that they haven't dealt with yet. So that makes me think that the therapy is not a quick one.
Oh no.
Right?
Yes, it can be quite substantial and quite timely as far as the amount of work. And you know, sometimes that can be overwhelming to a client to commit to that type of work.
Right, and nobody wants to have made progress and then it stalls. You want to keep that momentum going. So Charles, I'll bring you into the conversation because since we've known you, you've been talking about the fact that you work in tandem with specialists like Anna here to kind of help people get over that hump, so to speak.
Oh, definitely. The counselors are the other half of our process. What we do is designed to kind of set the brain in a position to where it can move in a new direction, take in new information. But what do we do once we get the physiology straightened out? That's where the therapists are so vital to our process. They carry the patient forward and they grow them in the direction the patient chooses to go, as opposed to just allowing the trauma to re-traumatize, or we're not. And as far as we're concerned, we work with Anna and her group as well as many other groups in the Chattanooga area in a very forward-focused approach.
Well, because you're always real quick to step back. He'll do this and say, I don't want to pretend like I am your sole fix here. You are just a piece of the solution for people. Is that fair to say, Charles?
I think that's absolutely fair. We work in tandem with psychiatrists, counselors, other mental health providers, other healthcare providers in other areas. Even with chronic pain issues, we work with pain management, we work with internal medicine providers. We are just another piece of the puzzle to help get patients just a little farther. Okay,
I know you've said this 1,000 times, but I'm going to make you say it 1,001 because Anna kind of touched on it. What you're doing at Scenic City Neurotherapy, it's ketamine infusions, but they're very kind of mild levels. Is that right?
Yeah, ketamine infusion therapy, we take a very low dose anesthetic, which ketamine being a primary children anesthetic, we use a very low dose, slowly infused over a period of time to elicit a physiologic response and initially optimize the way the brain communicates. It's like hitting the reset button.
So for you, Anna, as the therapist here, it must be really gratifying for you to know that you've got this resource in him, because otherwise people could give up, right?
Yes, so it gets them over that kind of plateau hump to where they start to feel better, where their brain is more resourced to give them the ability to see that change. And the thing with the ketamine infusion is it's such an immediate and such a tangible change that what we're trying to do is really capitalize on that and optimize that for long-term progress. So what might happen is you see the immediate change and there might be some regression.
Okay.
And so we're trying to capitalize on that and allow the brain to actually heal so that you see long-lasting progress and change in life, and you really can optimize who you are and how you interact with the world.
So because so often people have had a past difficulty in their life, obviously they found some way to cope with that, whether it's effective or not, but they did find a way to cope with that. So is it often in PTSD cases that a person might not even know they have PTSD because they just react that way anyway?
Yeah, so right, so we're adaptive organisms, and we're really clever about the things that we come up with to navigate a situation. And what might happen is when you create one solution, that solution is in turn creating another problem, and so on and so forth. And so things that might have allowed you to survive, allowed you to get through a difficult situation, might be the things that are holding you back from being able to fully integrate that and progress towards full healing.
And is the therapy that people do with you just the coming in and kind of opening up, exposing yourself on a regular basis? That's exhausting.
So actually, no. That can be counterproductive and re-traumatizing.
Okay.
So you actually don't ever really have to tell the details of events that you've been through for your brain to be able to integrate.
Really?
Yeah, so, and that's some of the old school thinking was that way. And that can actually be detrimental to progress and detrimental to the client's functioning. So trauma treatment really kind of has 4 phases. So the first phase is just like any other therapy. It's the assessment and orientation phase, where the therapist gets to understand the client gets familiar with working with the therapist, and you decide on kind of goals that you want to achieve and how you're going to help them with their presenting issue. And then with trauma treatment, you go into the second phase, which is skill building and psychoeducation. So it's really important for the client to understand what's happening physiologically with them and what those patterns are actually doing for them.
I'm going to let you pause there a minute because we only have a minute left, but do you see the detail that she puts in to bringing the best treatment she can and counseling she can to your case? And then you've got Charles over there as your counterpart to help people get over that hump. So Charles, at Scenic City, it all begins with a phone call and a free consultation?
Absolutely, yeah. The first thing you do, give us a call and we come in and talk, and it's no cost to the patient, it's just a conversation.
All right, here's where you can find Charles at Scenic City Neurotherapy on Shallowford Road. The phone number is 228-0579, online at sceniccityneuroTherapy.com. And Anna McCurdy is with RailRoad Valley Therapeutics. Are you taking patients?
I am.
Okay,
Yeah.
and she's on Dayton Boulevard. Her phone number is 208-9206, and online for her, it's simply railroadvalley.com. Thank you both.
Thank you for having us.